Hello, my name is Dr. Rachel Glick. I am a board-qualified podiatrist and director of the Ankle and Foot Centers at Belmont location. Pain, no matter where in the body, is never normal. And if it persists more than 72 hours, it should be evaluated by a licensed physician. I wanted to talk to you a bit about some foot pathology I see as a podiatrist in our offices. First, I wanted to discuss bunions. A bunion is a bony prominence on the side of the foot at the base of the great toe joint. This enlargement of the joint can be aggravated by sports or tight shoes. The big toe will drift sideways and cause an increase in the bunion bump. This sideways drift also affects other toes and joints of the forefoot by pressing on them and can cause additional arthritis or more pain in other areas of the foot, often developing a neuroma or pain in the ball of the foot called metatarsalgia. Another common problem I see in the big toe joint is a prominence on top of the joint. This condition is called hallux limitus. It is a limitation in the motion of the great toe. This issue tends to be progressive and, if left untreated, can cause arthritis and limit your ability to walk pain-free or enjoy activity. A hammer toe affects one or both joints of an individual or multiple toes. It results in a bending type deformity of the toe. Ligaments and tendons of the toe are tightened, which cause the joint to buckle and prevent it from lying flat. Although hammer toes are largely genetic, bunions can push the great toe against other toes, causing this type of contracture. With time, the toe joints can swell, causing pain and possibly a corn or callus to form with the constant rubbing of shoe wear. Conservative treatments aim in reducing symptoms and are always tried first. Surgical correction or realignment of the joint is a more definitive approach in ridding the pain from the bony prominence or irritated joint and has a better rate in preventing recurrence of the pain. Surgical correction for a bunion or hammer toe is performed in an outpatient setting, and because of current fixation techniques, early protected weight bearing is possible. Pain is minimized with just rest, ice, and elevation of the affected limb. Digital x-rays are taken throughout the postoperative course to monitor bone healing, and in-house physical therapy is available at ankle and foot centers to help achieve your goals to return to normal activity. Again, I am Dr. Rachel Glick, and on behalf of myself and the entire staff at Ankle and Foot Centers, we'd like to let you know that same day or next day appointments are available. We look forward to meeting you and thank you for entrusting us with your care.